So we have been talking about the big companies. We've been talking about Apple and Google and Amazon and Walmart and all the big companies and all the big EMR companies. You know, legacy companies are not the only ones that are trying to enter this market. You know, I'm CEO of a medical startup company. It's been the most challenging and rewarding thing I've ever done, and it's always something new every day. What role do you think startups are playing in this disruption of healthcare? Do they have a role? Is it significant? How might it impact it? I'll toss that to you.
Well, that's the lifeblood of innovation right there. They're small, they're nimble, they're smart, and many of these companies are founded by people who have had a medical problem or a kid with a problem. And so they figured out a hack and they figured out how to scale it. You know, you talked about Athena Health earlier, and it's interesting because they first disrupted by doing something really boring in the back of doctors' offices. They worked with fax machines and paper, and they took that off of the workflow, to Colin's point, of the physician, and they've grown and grown and grown, and now they'll probably get sold to somebody
multi-billion-dollar company.
Bigger.
And then that multi-billion-dollar company will mess it up, right? Look at IBM, look at Watson.
We hope not.
Gobbled up a bunch of startups that were doing great in their own right, and then non-healthcare company tries to get into healthcare, big bureaucracy meets small startup innovation, and that got halted.
Well,
right?
we hope that doesn't happen
Of
because
course.
there are these gems, these pearls that we want to see flourish.
Well, there's 2 points I think that are interesting here. Number one, how many IPOs were there last year in the health tech space? Zero.
Yeah,
there were zero. The nature of innovation is such that it's acquisition model. So number one, big pharma is looking to buy those companies. So that's the one insight. Those little companies that start in the garage are the lightning bolt. And I go back to the proverbial three-legged stool. It's lightning, market validation, clinical validation and market access. And it's those three things. The other thing that's real interesting to me is that every innovator isn't Elon Musk. Every innovator isn't some big, bold guy yelling at the top of his or her lungs. And especially in healthcare, innovation can be fragile. And we have to coddle innovation in a way that we recognize that that poor mom with a kid with cystic fibrosis might have a brilliant idea, but she doesn't yell as loud as Elon Musk. So to me, those are really interesting dynamics that play into this very, very complex market.
You're spot on. And we also have to have an appetite for failure, right? Why are providers not part of the conversation? Why are hospital systems not part of the conversation? They are in pockets of the country in small pilots, but there's, first of all, very small margins to play with. And secondly, this appetite for failure. We've got to say, we expect you to innovate, and you're not going to get it right the first time. Very few do. There has to be an appetite for failure, and there has to be a budget for failure so that hopefully there's that one lightning bolt.
You know, when everybody talks about the proverbial exponential curve, right? We've seen that exponential curve. And when you plot it against a traditional pharma linear 5 or 10% growth, there's an area early on that dips below traditional growth. And that's where every manager, every CEO gets nervous. So number one, you have to plan to fail. Number two, you have to realize that even early innovations that work is below the line, and that's an important sort of construct.
Well, and I think that's what large companies are doing with that acquisition model you mentioned, John, where, look, you know, these little startups, they can afford to operate at a smaller scale, they can be a lot more nimble, and they can fail, and then these bigger organizations can come in and either help them, or they acquire them when they've proven the model, they've worked out all the kinks, they've pivoted 4 or 5 times and found the right formula. And for me, you know, that's what's exciting about some of this new crop of innovators that are coming out. They're not the lightning bolt, I would say. However, they're taking models that have worked in other industries and now applying it to healthcare. One company that I know is Care Cognetics. They're taking sort of this loyalty program that a casino uses, and they're applying it to healthcare to motivate behaviors, to really provide that concierge kind of feeling that a VIP would feel at a casino. Now, I look at that and go, well, that's not that innovative. I mean, those guys that win, they do this all the time. But they're applying it in healthcare, and they're respecting the rules of healthcare around HIPAA, around physicians.
Colin, we have to replace the I with a different I. And innovation is probably better served in many instances by implementation. Take a look at telemedicine. I mean, telemedicine works, we have the methodology, we just have to implement it well. And I think a lot of innovation is really that kind of dynamic.
Well, I think most startups lack that. They have all the innovators, they have all the smart people, they have all the passion, but you have to have that implementer on the team. And what you'll see with the Medtronics of the world, Medtronic is big blue in the CRM, cardiac rhythm management space. They make all the heart valves. They're the market leader. And do they continue to improve their products? Yes. Are they innovating on the outskirts? Probably not as much, because they're looking at what Covidien or what this person is doing or this person is doing and saying, rather than spend hundreds of millions of dollars, we'll just suck them into our vortex and improve upon it or not. That's good and bad, like you mentioned. It's good in that those technologies finally have a voice. It's bad in that sometimes those technologies can get lost in a really deep pool and never come to fruition.
But I think it's a big cycle. We've seen it happen, where a company will acquire this really hot startup with really great technology and blow it, right? It doesn't get implemented, it loses momentum, and guess what happens? That gets spun out. Those founders go out and they start another one, and they start it again. And you know what? I don't see it as a bad thing, because I think it's 50-50 in my mind, where it actually may work. Some company will acquire it, and they'll actually pour in the right access, the right dollars, the right people to really make it sustained success.